Cartilage damage, causes and symptoms. Cartilage is a connective tissue found in many parts of the body. Although it is a tough and flexible material, it is relatively easy to damage. This fine rubbery tissue acts as a cushion between the bones of joints. People with cartilage damage commonly experience joint pain, stiffness, and inflammation or swelling. In this video, we will describe the function of cartilage, how it can become damaged, and how that damage can be treated. What is cartilage? Cartilage has several functions in the human body. Reduces friction and acts as a cushion between joints and helps support our weight when we run, bend, and stretch. Holds bones together, for instance the bones of the rib cage. Some body parts are made almost entirely of cartilage, for example the external parts of our ears. In children, the ends of the long bones are made of cartilage, which eventually turns into bone. Unlike other types of tissue, cartilage does not have a blood supply. Because of this, damaged cartilage takes much longer to heal compared with other tissues that are supplied by blood. There are three types of cartilage: elastic cartilage or yellow cartilage, the most springy and supple type of cartilage. Elastic cartilage makes up the outside of the ears and some of the nose. Fibrocartilage, the toughest type of cartilage able to withstand heavy weights. It is found between the disc and vertebra of the spine and between the bones of the hip and pelvis. Hyaline cartilage, springy, tough, and elastic. It is found between the ribs, around the windpipe, and between the joints. Articular cartilage. Elastic cartilage, fibrocartilage, and hyaline cartilage can all be damaged. For example, a slip disc is a type of fibrocartilage damage, while a hard impact on the ear can cause elastic cartilage damage. When cartilage in a joint is damaged, it can cause severe pain, inflammation, and some degree of disability. This is known as articular cartilage. According to the National Institutes of Health, 1/3 of American adults aged over 45 suffers from some type of knee pain. Symptoms. Patients with damage to the cartilage in a joint or articular cartilage damage will experience inflammation. The area swells, becomes warmer than other parts of the body, and is tender, sore, and painful. Stiffness. Range limitation. As the damage progresses, the affected limb will not move so freely and easily. Articular cartilage damage most commonly occurs in the knee, but the elbow, wrist, ankle, shoulder, and hip joint can also be affected. In severe cases, a piece of cartilage can break off and the joint can become locked. This can lead to hemarthrosis, bleeding in the joint. The area may become blotchy and have a bruised appearance. Causes. Direct blow. If a joint receives a heavy impact, perhaps during a bad fall or an automobile accident, the cartilage may be damaged. Sports people have a high risk of suffering from articular damage, especially those involved in high impact sports like American football, rugby, and wrestling. Wear and tear. A joint that experiences a long period of stress can become damaged. Obese individuals are more likely to damage their knee over a 20-year period than a person of normal weight. simply because the body is under a much higher degree of physical stress, inflammation, breakdown, and eventual loss of cartilage in the joints is known as osteoarthritis. Lack of movement. The joints need to move regularly to remain healthy. Long periods of inactivity or immobility increase the risk of damage to the cartilage. Diagnosis. Telling the difference between cartilage damage in the knee and a sprain or ligament damage is not easy because the symptoms can be similar. However, modern non-invasive tests make the job much easier than it used to be. After carrying out a physical examination, the doctor may order the following diagnostic tests: magnetic resonance imaging or MRI. The device uses a magnetic field and radio waves to create detailed images of the body. Although useful, an MRI cannot always detect cartilage damage. Arthroscopy. A tube-like instrument or arthroscope is inserted into a joint to examine and repair it. This procedure can help determine the extent of cartilage damage. Exercises. A physical therapist can suggest exercises that are suitable for an individual to strengthen the muscles around the joint. This will reduce pressure on the area with the damaged cartilage. The Arthritis Foundation recommends gentle stretching to maintain flexibility and range of motion, aerobic and endurance training to achieve or maintain a healthy weight and improve mood and stamina, strengthening exercises to build up the muscles around the joints. While exercise offers many benefits, it seems unlikely to result in a regeneration of cartilage. Complications. If left untreated, the joint, especially if it is a weight-bearing one such as the knee, can eventually become so damaged that the person cannot walk. Apart from immobility, the pain may slowly get worse. All small articular cartilage defects can eventually progress to osteoarthritis if given enough time.